Everyone wants to take their business, their skills, to the next level. Small and mid-sized business owners have exceptional insight into how to do this. They endure and thrive because they find ways to overcome the challenges that come their way, and they can teach us valuable lessons to apply to our own companies and lives. Stephen Neuner, founder and owner of Alkali, a company with a unique process that helps businesses more effectively buy and manage their insurance programs. And Bob Gibbons, builder of Riata Commercial Realty, a real estate advisor and tenant advocate, are two prominent Metroplex businessmen who, along with their weekly guests, will ask their and your probing questions, finding impactful solutions that will help you reach for the next level. Here are your hosts, Stephen Neuner and Bob Gibbons.
Welcome to The Next Level, conversations that propel business. I'm your host, Stephen Neuner.
And this is Bob Gibbons, and we're here with another interesting show today, and Stephen Neuner is going to be our guest.
Oh, boy.
Every now and then we've got to just bring it right back to one of us, see if we have any wisdom to share. But the thing today is called What the Health is Going On. And as anybody that's listened to this show for very long knows, Stephen's company is called Alkali Services. They're a insurance and benefits brokerage firm. They manage insurance programs for their clients, help them manage it and better. And he's an endorsed local provider through the Dave Ramsey organization. And Alkali can be found online at alkaliservices.com, and Alkali is spelled A-L-K-A-L-I. And so Stephen's an expert on health insurance and health benefits and whether everything going on through Obamacare and now the Trump administration doing whatever it is they're doing. We're gonna talk about that.
We're trying to do.
And the reason this is so important is because it is, payroll is usually the top expense for most companies, and the payroll and benefits is always number one. In some cases, benefits can be number two. The number two expense. Sometimes it may be occupancy cost, depending on how you deal with it. But in any case, it's a big, big issue, and retaining employees is such a big issue. So I thought we ought to talk about health insurance.
That might be the longest intro we've had yet.
Only 2 minutes.
And I really just... You said it all, and it was a great commercial for me. Thanks, Bob.
You're welcome.
The show's all yours now.
I think we were setting you up. I wasn't trying to...
Trying to raise some expectations here.
All right, so
pressure's on.
First of all, do you have a witty quote?
A witty quote, maybe not, but I do have one that I like.
Okay.
And it is, I think it's applicable to this conversation because let me give the quote. Worrying does not rob tomorrow of its sorrow. It robs today of its strength. And I have no idea who said it, but I like it.
So worrying robs tomorrow of its...
Doesn't rob tomorrow of its sorrow.
Because it's going to be there anyway.
Sorrow is going to be there anyway, but it does rob today of the strength. Of its strength. And I think it's applicable because with all of the craziness, one of the biggest things we do, I think, as a company is... for our clients is provide clarity and confidence and then bring in our capabilities to help solve problems. And I think people feel a lot of times paralyzed with the healthcare issue because there's a lot of moving parts. They're out of a lot of people's control. You feel almost victimized by the system. And so there's an emotional element to it because it's real, it's personal, it's expensive. It can impact your business. It impacts the people you care about. I mean, so there's just a lot wrapped up in it. And sometimes we find that, with it, with all of that, people get charged sometimes, and then they don't always make good choices. So getting people down, we gotta keep our eye on tomorrow, but no one really knows in this environment what tomorrow is going to bring. So let's get clear and make the best decisions we can for today.
And worrying's not going to change anything. So that.
Right.
My father worried a lot, and it was frustrating because he spent so much time on it, and yet it still made no difference to the way things actually turned out.
Yeah.
And I think there's a huge difference between planning and worrying. And worrying is always fearing what's going to go wrong and how bad things are going to be. And I don't think there's any value in that.
Well, and I mean, honestly, one of the biggest weird, strange blessings, and this is after we took 20% revenue cuts and up to 60% revenue cuts when the Affordable Care Act, Obamacare, first passed. Our whole industry they were like, it's going to be unconstitutional. We're going to, it's not, first it's never going to happen, then it happens, and, we're going to fight it and everything. And I'm not going to lie and say that I didn't agree with a lot of that. But what I said, the distinction, because I was so young in the business, I was like, I've got a family to feed. I can't just put all my eggs in that basket and hope that this thing's just going to go away. I've got to become, people need help. I got to become the best at this. And so I took that approach, and I didn't know it at the time, but it really, really gave us a leg up because, it did end up hanging around, and a lot of people really needed help. And so we became experts through just not necessarily being okay with it, but just saying, hey, we gotta make some lemonade out of this lemon.
Okay, so the Obamacare came into effect in 2010, wasn't it?
Yeah.
And so when that happened, what was the big shift that came along?
Yeah, I mean, the big shift was, everyone called it Affordable Care Act. Everyone was focused on and talked about health care, and still do today. Everyone we're all going to talk about is people will talk about health care and a rising cost of health care, and health care is out of control. But usually when you drill down on it and you're talking to most people, the two subjects that everyone's looking at, they're looking at the government, right? And they're looking at the insurance companies. And so the big shift that happened with Obamacare or Affordable Care Act is we basically went after the insurance companies, and we started regulating how they, how they operated their businesses and their practices,
and really how they accept clients, right?
And how they accept clients, and what their profit margins can or cannot be, et cetera, et cetera. And so, so that was the big shift, is that we fundamentally changed some of those things. But the reason why we're still having issues is a lot of it was designed intellectually, academically. But it's hard to predict what human behavior is going to be. So a lot of the human behavior did not follow what they projected. So we've seen rising costs there. But the second reason is because we never really addressed costs to begin with. And I can't remember the exact study, but before the law passed, I saw a study that said if you took all the insurance companies' profits in the United States and you added them up, you basically pay for 3 days of healthcare spending in the United States.
Wow.
And so we're not saying that the insurance companies aren't part of the problem, but they're like a very small part. But the law really went after health insurance. There's so many other cost drivers in the system that we haven't even touched, and we're largely ignoring. And whether or not we want the government to be involved with those things is a whole other conversation. But the law itself did not really change any of those fundamental underlying factors.
Okay, so since that was passed in 2010, the Republicans have been trying to get rid of it, modify it, change it, whatever, ever since.
Yes.
And so
70 times.
Wait a minute, 70?
70 failed Republican attempts to, maybe more now, at least 70 that we could find, where they've tried to repeal, replace, or change the law.
Wow, they've been horribly ineffective.
Which is where Trump warned Republicans. He made big press saying, I'll work with the Democrats if we need to get it done.
Which he did some sort of executive order.
When that wasn't going anywhere, so then he did this executive order, which a lot of people, depending on who you talk to, think that it was basically, we're going to destabilize this thing and force them to act.
So what
whether
does
or not
his
they will or not, it's another problem.
What does his executive order even do?
One big one is it eliminates cost-sharing subsidies. So the subsidies that help fund people to buy health insurance through the marketplace or insurance exchanges. And so lower income subsidies he's eliminating those subsidies.
Which was one of the main things about Obamacare, to make sure everybody had access to health care.
Well, yeah, one of the things that they said, yes, that was one of the pieces.
So by doing that, does that automatically throw millions of people out of health insurance?
Well, if they make the choice that they can't come up with the money somewhere else or whatever, it does affect the affordability from people that are receiving it, right? So it's going to have adjustments to that. And then that's where Congress came together, bipartisan, and tried to come up with a 2-year program to stabilize it, to allow for some sort of transition. last I saw, Trump tweeted that he doubted that he would support that. So, if you want to stay up to the moment, you literally have to just kind of watch his tweets.
Watch Twitter constantly.
Yeah.
All right, so he says we're going to get rid of those things. Congress is saying we're trying to figure out a way to make that happen. So what happens in the meantime?
Well, like I said, those are going to be eliminated. So
he can unilaterally do that.
Well, it's a provision. Yes, he can with an executive order.
Wow, that's pretty amazing. Now, one of the things I noticed in the executive order was that he said something about association health plans.
Yep.
And so historically, the only groups that I'm aware of that could go and collectively buy insurance are companies or unions.
Correct.
No, like associations of doctors, of realtors, of whatever,
right,
can do that.
Right.
So if you're not employed or a part of a union, then your only option is an individual plan.
Well, and actually, historically, you could do them. Affordable Care Act went after the ability to be able to do them, so then they stopped. Okay, so a lot of them did not work out under ACA, and so they all went away. He has reopened that up. So Trump really is going after a couple different things. So in this case, he's trying to allow more options for people to be able to find affordable ways of buying the insurance. Okay. And that's what he's trying to do by creating the association. But the other thing he's doing is trying to let small employers band together, right? And then basically buy group insurance as a larger group, because the regulatory requirements of what you have to buy in a large group insurance product is not the same as what a small company has to buy. So small companies get a whole bunch of things, provisions jammed into their coverage that they may or may not want, that a large company doesn't have to buy under the Affordable Care Act.
So is there any downside to him doing that?
Well, the biggest downside right now is it creates confusion, and there's no way anyone can implement anything for this year in this open enrollment. So it's really something that's longer term. But it depends on your mindset. I'm of the mindset that more options is always better, right? More freedom and be able to creatively come up with solutions is better. And then the numbers work themselves out, free market controls. But other people think it's a terrible idea, and it's going to destabilize everything.
Our show is all about entrepreneurism.
Sure.
And it seems like anything we can do to make sure that health insurance by itself doesn't get in the way of somebody being able to quit a company and go start a new company should be a good thing. So like in my case, whenever I was employed, I was under a big corporate plan. It was great.
Yep.
Then let's say I didn't quit. I got laid off.
It's a new form of entering entrepreneurship.
I'm a reluctant entrepreneur. So then I was suddenly having to go, fend for myself to find insurance. And if there had been portability of that insurance, it seems like it would have made my life a lot easier. And that would have been one less thing I would have had to worry about going out on my own.
Well, and a lot of times that's a misnomer, because depending on where you're at, a lot of the time there was portability. I mean, not a portability, that exact coverage and that exact rate, because you were probably with a large employer that was self-insured and had all kinds of different variables going on. But typically people get COBRA, and then they have a state continuation option depending on which state and who they work for. And then there was, before ACA, there was actually what's called a Texas high risk pool. So if you're uninsurable, you couldn't buy insurance that was underwritten under the normal business practices back then. You could have bought insurance through the state high risk pool. Okay. It just was more expensive, which was the bigger thing why a lot of people didn't.
All right, we're going to go to a break. When we come back, we're going to talk about why have costs gone up so much.
Stick around.
And now, Confessions of a Recovering Landlord.
This is Bob Gibbons with Riata Commercial Realty, and I am your recovering landlord. After 20 years as a landlord, I now use that experience only for the benefit of companies that lease or buy office buildings and warehouses. Today's confession: knowledge is power. We all negotiate from a position of power and strength, or at least we want to. In any negotiation, the party with the most knowledge probably has the upper hand. And landlords count on this being the case whenever you're negotiating a lease, because most landlords are professional real estate investors and they hire professional leasing agents and property managers. Landlords are in the market every day negotiating leases, while tenants probably only negotiate 1, maybe 2 leases every few years. So tenants feel outgunned. Don't let landlords have all the power. As a former landlord for 20 years, I understand how landlords think and what motivates them. So let me put that knowledge and experience to work on your side of the negotiation. To learn more, contact me at TexasTenantRep.com. Again, that's TexasTenantRep.com.
Have you started making plans to take your business to the next level in 2016? Hi, I'm Stephen Neuner, founder and CEO of Alkali. We have a trademark process called the Empowered Advantage that enables CEOs, business owners, and entrepreneurs to more effectively buy and manage their insurance. Before sitting down to make your plans for the new year, here are just a few things to consider. Would you say that you have an actual insurance strategy, one that you can articulate? Or have you just purchased a policy here and there over the years? If you have an insurance strategy, was it discussed under the pressure of a renewal deadline or considered earlier in the year to avoid fire drill decision making? If your answer was no to either of these questions, then you may not have the right partner on your team. Visit alkaliservices.com to contact us and take the next step to a bigger and better future.
My name is Jim Tolbert, and I am the CEO of Vista College. Bob and Stephen, come see me. I'll give you both scholarships for our business program. Clearly, you need it.
Welcome back to The Next Level, Conversations that Propel Business. We're here with Stephen Neuner of Alkali Services, and you can find them at alkaliservices.com.
Hey there, Bob.
So before the break, I mentioned rising healthcare costs and why are they going up so much. So give me the rundown. We don't need to go into a great deal of detail, but
You need about 2 hours. So.
I know, that's what I'm saying. We don't need to go into a lot of detail. But
I mean, high level, just a couple of things. One, we're all going to die. Yet, as a society, yeah, we are. Never met anyone who's not yet. But we're willing to spend exorbitant amounts of money. I'm not saying this is good or bad, but we're willing to spend tons of money at the end of someone's life to keep them alive, right? Or tons of other people's money. A lot of times, so we spend massive amounts of health care at the end of life.
Yep.
Again, I'm not saying, I'm not making a comment on it, but it's a fact, or we spend a lot right then. Also, just laws and regulations that have been enacted so far, like I mentioned earlier, aren't creating the behavior that they wanted. They thought they were going to get all these young, healthy people in the insurance pool that were going to pay premiums and not use the plan and all that stuff. We actually had very few of them, comparatively what they were hoping and projecting, actually join and take coverage. And we got a lot of sicker people who didn't have coverage before. So again, I'm not saying good or bad, go into the system, so we have increasing costs that way.
right.
Mergers and acquisitions, private equity. I love free market, enterprise, but hospitals, you'll see right now they're buying freestanding entrepreneurial businesses like MRI clinics, CT clinics, and they have much more lucrative contracts with the insurance company. So if I can buy, the MRI, lab facility that's charging $300 for something, and I can immediately bill $1,000 because I have hospital rates with the. It's a great way to make money.
How about litigation? How much does litigation have?
Litigation's a big deal. Cuts to when the federal government makes cuts because they're trying to watch the budget on. The U.S. government between military, government employees, Medicaid, et cetera, Medicare, we spend about 2/3. They purchase about 2/3 of our health care. So when they go negotiate with a physician, they go to your physician that you've gone to for 20 years and they say, hey, we're cutting our Medicare reimbursement. We're paying you $300 now. We're not going to pay you $200. It's not a negotiation. They just say, this is when it's going to happen and this is by when. And so now that doctor's going to decide where I'm going to make up that delta. My employees still want raises. I have to buy health care. It's going up.
Malpractice insurance.
Malpractice insurance. So they have increasing costs. So it's a balloon. When the government squeezes, it inflates elsewhere. So a lot of people that buy insurance feel that, right?
Okay.
So
they're going up crazy. Prescriptions are going up so much, it's insane. But
Yep.
So give me some idea, where are you seeing the entrepreneurial spirit helping to control costs or create new ways of doing things that will be at a lower cost?
Yeah, it's happening everywhere, but the thing is, we don't know which ones are gonna
Work.
really, really take flight, right? So
Okay.
one cool one that just a couple cool ones. So one cool one that I think is neat is University of Texas has developed a cancer finding pin.
Like
Okay.
it looks like a writing pen?
It looks like a writing pen, okay? And so typically, let's say a woman has a breast cancer and she has to have a mastectomy, or And so sometimes what would happen is they don't cut all the cancer out, or there's other surgeries where they're trying to cut out and remove the cancer. And so they perform the operation and they put them back together, so to speak, and then they find out later through a test or whatever that they didn't get it all. Well, so then they had to have a second surgery, more painful, more costly, higher degree of complication. So by having this pin that they can use in a surgery and literally detect to make sure they got it all is a game changer.
And is that actually in the market yet?
It is 96% accuracy by most of the tests. It's still in kind of testing. It's not, but I mean, it's coming hopefully very soon. So
okay.
that'll reduce costs. There's some really sci-fi type stuff, but basically Ohio State's developed a device that reprograms skin cells into other types of cells to help treat diseases. And so they basically had a lab rat that's what the level of stage testing is, not testing humans, but it had a severe injury to its leg. And through this technology, they basically were able to heal its leg in record time.
Wow.
Fully repair and rejuvenate it. Kind of a Benjamin Button style type thing.
How about like 3D printing? Is that, I mean, I've seen that in so many applications. Is that hitting medical at all?
Yeah, my favorite one, in fact, Bob, it's almost like you're just setting me up here.
It's almost like.
Yeah. There's one actually in England, and I like this one because it's truly entrepreneurial. It's Team Unlimited. UNLIMBITED, and basically they are 3D printing prosthetics. This guy grew up with a prosthetic. Often prosthetics are super expensive, and so when you're a kid and you're growing fast, a lot of parents don't want to buy them for their kids because they have to adjust.
Keep changing them, yeah.
Yep, keep changing them. And so this guy got together with a 3D printer and said, hey, let's do something about this. So they dramatically reduced the cost, and then they are also doing super cool designs. There's like an Iron Man arm, and I mean, like stuff that like if you're a little boy or a little girl that you're just, I mean, if
That's
you're
awesome.
with that, I mean, it's neat, right?
Yeah, because I just read that book, Unstoppable, about that guy that had both legs blown off in the bombing in Boston at the marathon.
Uh-huh.
And in that book, he said that it was going to cost $100,000 per leg for the prosthetics.
Yeah. So now imagine 3D printing that, right? And imagine why parents would want to buy that for their kid when they're going through growth spurts left and right.
Oh, my goodness.
So
that's
now,
amazing.
These kids get to have a better quality of life, and we've dramatically reduced the cost, and they can be very, very customized.
Okay, so let me put you on the spot now. You're Stephen Neuner, the great. You're
Lord.
the founder
People are tuning off right
of
now.
Alkali Services. So what I want to know is what strategies can you offer your clients to help them manage all these costs to, not have these gigantic increases from year to year while still providing decent coverage for their employees?
Yeah. I mean, there's so many things in that, right? And it's really, really tough to say here's the one silver bullet, right? But it's being creative. It's bringing that entrepreneurial spirit to of looking at things. Typically in our industry, it's just sell the product and here's your rate increase, and people almost get numb to the amount of increases. We try to ingrain in our team one of our core values, entrepreneurial spirit. We try to have people we in our first core values, treat others the way you want to be treated. So we look at it as our money, right? We put ourselves in a client's shoes, and then we try to be creative. And there are creative solutions out there. There are things that we've implemented. One of the big ones you see on the horizon right now that's come out of ACA is what's called level funded solutions, which is a step closer to being partially self-funded, going to a self-funded type of insurance.
Okay.
And so what that looks like is for a typical employer, your cost doesn't necessarily increase or decrease immediately. You have a budget, you pay your premium every month like you're used to. But if we can, through education, through other telehealth services, things that we can wrap around your plan, if we can reduce the cost of your health insurance spend, how much your employees are spending throughout the year, at the end of the year, you can actually get money back. So you can get part of that surplus, which ultimately you can pass back to your employees and start lowering the rates. So it gives you a lot more control. You get better data, and you can start making better decisions. And again, you got to have a good partner because you need some education with this strategy. But it's a very simple way that a small company, as few as 20, 30 employees can take a step and start participating in the underwriting profit and and doing a better job managing their own health care.
So self-funding by itself doesn't necessarily lower costs unless it's partnered with some of these other programs to try and get buy-in from the employees.
Right. Well, and this is just a step towards it because there's no real risk to go into a program like this. Basically, if you have a scorched earth scenario and everyone gets super sick, you'll owe no more than your budget. So when at the end of the year, you get to participate in the savings, you don't get to keep all the savings, right? Then there's then there's true self-funding, which you mentioned, which is where like if there's savings, you get it. And that is a even more aggressive approach. There is a little bit more risk. Sometimes with those, you might spend, if things go really bad, we still buy insurance to back it up, but you might spend anywhere from 10 to 25% more than your renewal would have been from Blue Cross or United or whatever if things go really bad. But if we can bend the curve down by 20%, you just save 20% on your health care. So
seems like you have to have a big population to really make that work.
Larger populations, you definitely need that. You definitely need time and bandwidth to really, really look at the data. I mean, the big things, our big success stories are really getting in there and looking at the data. We had one client that had on average 16 babies a year. We found through looking at the data that the babies were ranging anywhere from $7,000 to $35,000. So we created an incentive program where we gave the employees $1,000 that they deliver at these low-cost, high-quality facilities, and we were getting a 5-to-1 return on investment. So basically, we give them $1,000, they deliver at the place, and because we're self-funded with a $25,000 deductible per employee, not the employee, but the company
the
had
company's doing it.
We were almost paying that whole labor and delivery anyway. So we were saving $5,000 for every $1,000 we gave the employee.
That's incredible.
Yeah.
Now
you got to have the time for that, though.
And one of the big things is, what about employee choice? Because employees aren't going to all agree necessarily. So how do you, as an employer, determine what the employees really want?
Yeah, and that's a really big deal, especially as you're looking at making changes and if you're forced to make cuts. We're really, really big on if it is truly an employee benefit. I've seen the best, well-intentioned, we love our employees, companies with the best culture, and sometimes the C-suite gets a little bit disconnected from what Sally and shipping really values. And so what we try to do, we have something called the Partnership Accelerator, which is a survey that basically allows employees to tell us what they want, but not say I want it all and want it free. They have to force rank what's important to them and what they value most. And then you develop the strategy around that. And then when you make changes, or if you even have to make cuts, you can say, hey, we listened to you. Here's what we did, right? And sometimes you'll be surprised because it can be really shocking at what you think people value, and it's actually something very, very different.
Well, and usually we think of benefits as being the health insurance, but there are a lot of other things that come under that umbrella of benefits, right?
Absolutely. I mean, all kinds of things that people will value that, or not value. We had one client that they spent a gazillion dollars, I'm exaggerating, but a lot of money for high dollar real estate just to have ping pong tables and flat screens, and it ranked lower than company T-shirts and swag.
Oh my goodness, that's incredible.
Yep.
Well, Stephen, we got to cut it off there. We're out of time, but interesting stuff. A lot of strategies. So for our listeners, please go to alkaliservices.com to learn more and find out how you can better manage your spend on health benefits and employee benefits in general. We'll be back next week with another great guest.
Have a great week. Thanks so much.
You have been listening to The Next Level, Conversations That Propel Business with Stephen Neuner and Bob Gibbons. Join us every Tuesday at 1:30 p.m. for more prolific conversations that will take your business to the next level.